Okay, I've been teaching here for about 19 years and I've always used role play as a teaching strategy in the classroom, particularly for nursing students when I'm teaching practice-based skills, if you like. As the educator though, I was only semi-masked. In other words, I had props such as glasses, false teeth, I had a fat suit, and particularly one of my well-known characters I ever saw. Students could still see me as the educator. So in essence what that still created was an imbalance of me as the teacher and the student, so there was a power imbalance. So I don't believe that students got as much out of as I believe they could have. So then I started looking elsewhere and I came across some solid masks and I tried them in the classroom, used them once. They were not interactive, they were non-moving, and then I came across a company that actually built the props, built masks, and I got my first mask through a teaching award actually, and then I brought it into the classroom and I thought, I wonder if this works. It was amazing, the response was amazing, because I was totally then masked as the educator. So from there I thought there's more to this, so we started building it into the curriculum, using it regularly, and then I started to acquire a few more characters. And I guess the essence behind what I'm doing is that always the educator is hidden behind the prop. So it's a basically interplay between three, the learner, the character, and me as the educator. So when I'm becoming a character, one of the most fundamentally important elements is the history of that character, because the history then becomes the platform for teaching. So for example, my greatest character I think is Cyril Smith. And Cyril is a retired butcher. His granddaughter is also doing nursing. He's been in and out of hospital and he does a lot of first aid courses. So when he's actually in action with students, he's always teaching. But again, as the educator, I can direct that learning process, but Cyril's history allows it to be an authentic dialogue between the student and the patient. Interestingly, we've done some research now, just submitted one of our first journal articles. What we found from the study was that students were initially confronted by the characters because it was just so unreal. In fact, students didn't know if I was a real person or where did this person come from. So that confrontation and fear and thinking, well, what do we say to this poor person, or etc. So, and then of course in every session I always demask and debrief in the actual experience. So the second time I come and put that on again, they know that it's me, but they also forget that it's me, as the research was saying. So then they get this level of confidence, and the relationship with these characters builds with students over the period of time that they're in the program. And I can give you an example in terms of our students who have experienced it in first year. I then come in and out of their second year program, come in and out of their third year program, with the history of the character becoming more complex depending on what sort of learning that needs to occur. Last year, Cyril went to the students' graduation ball. He danced with the students. This year he went to the third year's graduation dinner and presented the awards. So he's actually very much part of the students' lives. When they're out there in their practice area, they often say, oh, I really did meet Cyril out there, or I really did meet one of the other characters. So the authenticity of the character also comes from the educator who so understands the discipline area.